Everyone with female reproductive organs is at risk of developing a gynecological cancer. According to the American Cancer Society, 109,000 new cases are diagnosed and 33,000 die each year. September is Gynecological Cancer Awareness Month, and joining me now is Dr. Allison Staley. She is with Rocky Mountain Gynecological Oncology. Thanks so much for joining us today. Let's talk about some examples of these cancers.
Sure. Yeah. Gynecologic cancers is kind of a bigger umbrella term for a lot of different female cancers. Most predominantly, and our most common one is going to be endometrial cancer, which is a uterine cancer. Ovarian and fallopian tube cancers are also ones I think a lot of people have heard, certainly. Cervical cancer, vaginal cancers, and vulvar cancers kind of round out the umbrella of what we take care of.
How has COVID and the pandemic changed things, maybe lessen people's doctor's appointments?
Yeah, certainly. I think we've seen a shift where people are getting back to a more normal routine. They're getting back into the healthcare system. But certainly for those years where we were really having kind of less frequency of visits and people were really staying at home more, there was less screening that was happening. People were coming in less, reporting new symptoms. And so now we're seeing people come in with more advanced cancers or symptoms that haven't been addressed in a timely manner.
What are symptoms of these types of cancer? What should we be looking out for?
It'll definitely differ based, of course, on what the cancer is. I think for endometrial or uterine cancer, the most common sign that you're going to see is abnormal bleeding. So for women who are postmenopausal, you shouldn't have any bleeding after that time. So if that's occurring, that is definitely a warning sign that you need to go to the physician and be evaluated. And for women who are premenopausal, having an abnormal bleeding pattern with menstruation is also something that should be evaluated too. Cancers in that age range are far less common, but it absolutely can be a sign. Particularly for women who are more at risk, who are obese in particular. And so having that evaluation by the doctor is important. Ovarian cancer is a really vague cancer, and that's kind of one of the reasons it's so harmful, because it really doesn't present itself at more advanced stages, and that's when people start to get symptoms. The most typical ones are going to be persistent abdominal bloating, maybe some abnormal bowel or bladder habits, or a decreased appetite with nausea or vomiting. Those could be some signs of that. And then lastly, cervical cancer, I think, is also kind of one of the more common ones. And for cervical cancer, this can actually be pretty silent until it gets a little more advanced. But pelvic pain and abnormal discharge and abnormal bleeding pattern can be some signs of that.
All right, Dr. Staley, thanks so much for talking to us about all of this really important information. Thank you. And of course, you can watch all of our health interviews right now on cbscolorado.com.